T-Bone and Heather in the morning on Star 98.3 and 97.7 The Bay.
10 minutes after 8 o'clock, 8:10, and joining us on the phone lines this morning, very patient man, Dr. Polsky. Good morning, sir. How are you?
Good morning. I'm doing well. How about the two of you?
But you know what?
Fine.
Not bad.
We're doing fine.
Yes, we're doing pretty good. Thank you so much for taking time out. You always do it, and you're very good with your time, and we appreciate you checking in this morning. So I want to get this absolutely out of the way.
What do you hate more, social media or COVID-19?
Well, I will say that I have shielded myself from social media.
Good man.
Up to this point, and I'm trying to minimize, but certainly this is my first, I would say, prolonged exposure to social media, and it makes me happy that up to this time, I don't have my own Facebook page, and I see where people really just get caught up to the point where I'm not sure that it's really healthy for a lot.
It is not healthy.
It's not healthy.
Now this is from you folks over in Calvert County at the Calvert County Health Department, and this is truly, I mean, it's in the first sentence, an extremely unusual situation. And what happened was on March 21st, a person connected to the 7-Eleven over there, and I believe it was on Howling Point Road, falsified a positive coronavirus test.
Said they were positive when they were not.
And then social media blew up, but a coworker actually went and got tested at a lab that was faster.
Right.
And that came back positive. So this person who stirred everything up in the beginning, I mean, it's just how, as somebody in the healthcare field, do you deal with something like this?
So our obligation is to deal with the health aspects. We can't control the social media aspects. And so what we've been doing since we got the report yesterday is to make sure, and this will be a continuing process, to make sure that those who have come in significant contact with the person who tested positive are also doing fine, and we will continue to monitor them for the 14 days. As far as being able to control what happens and doesn't happen on social media, that's certainly not our priority.
Of course.
Well, let's talk about your priority, because I'm sure you're up to your eyebrows with it. Cases in Calvert County, and how many do you guys have confirmed? And what can we, the populace, do to help you guys?
I think it's very, very important. I think some people are missing the forest for the trees. That the number of confirmed cases at this point are a very small fraction of the likely actual number of cases in the community. I would say at this point, based on what we're hearing from physicians, what we're hearing from the emergency room, that there are likely hundreds of cases in southern Maryland right now. What we have as far as confirmed cases in Calvert County, we had 4 over the last 24 hours. So we have now 7 confirmed cases in Calvert County. But again, I've seen people getting very caught up in one specific instance. Do we have 4 cases or 5 cases? The reality is that for every case that actually is officially diagnosed, there are likely at least 10 or 20 other cases. And so the behaviors that people are doing on a day-to-day basis, who are they associating with, how many trips are they taking outside the house, should not be based on whether we have 7 cases right now in Calvert County or 8. It should really be based on there is a potential that every time that they go to a grocery store, every time they go anywhere else, that there will be at least 1 or 2 other people in that store who are either very mildly symptomatic or don't have any symptoms at all that carry the virus.
And that's why the continuing message is what, Dr. Polsky, to help keep yourself healthy and the populace healthy.
Right. So the continuing message is that for people that have any substantial underlying health problems, that they should not be the ones going out for groceries or to the pharmacy. They should have a healthier or younger family member doing it for them, and that even for those people, they should be minimizing their contact out in public because they don't want to inadvertently pick up a virus and then bring it back home where maybe there's somebody who's more vulnerable.
Right. And let me ask you this, because people have been talking about this as well. What about, do we now have a coronavirus season? Like we have the flu season. Like what's the flu season? Like October to March or April? How does that work? Do we now have a coronavirus season?
I would divide it into two different types of coronaviruses. We have the more common that contribute to common colds. So common colds are caused by lots of different virus families. Coronavirus is one of those families. Those are clearly seasonal. And like you said, usually October, November, we start to see, along with flu, we start to see more people getting colds, and then that ebbs away as we get into March, April. When we get a mutated coronavirus, like we saw with SARS back in the early 2000s, and we saw with MERS, and now with this latest, what they're calling COVID-19, the mutations that occur that allow these viruses to be much more aggressive also potentially change the way that they transmit and potentially how hardy they may be. And the reality is that we won't know until we get into May and June if we see a natural diminishment. Typically, for coronaviruses, again, the more mundane coronaviruses, as the weather gets warmer and humidity picks up, we see those viruses recede. So we're hoping that will be the case with this virus, but we really won't know until we see what happens about close to 2 months from now.
Oh, wow. Hey, what happened with SARS? Did SARS just disappear? Did SARS just give up? What happened? Because I keep hearing people talk about that it just disappeared.
So it didn't just give up.
Okay.
It was actually a more lethal virus than what we're seeing with COVID-19. And oftentimes when we see viruses that are really lethal, they don't transmit as well because people get really sick really fast before they have a chance to transmit it to as many people.
Like Ebola.
Like Ebola, and it's much more obvious. And so it's easier to identify those people early and to get them quarantined. And so in cases like that, it's easier to really contain the virus. With COVID, because we do have people who have very mild symptoms and can transmit, and it looks likely that people with no symptoms can transmit, it's impossible to contain the virus. So what we're doing now is what they oftentimes refer to as mitigation, which is try to minimize the amount of spread.
Right.
And minimize the exposure to people who are most vulnerable.
Hey, how's the testing going in Calvert County? I mean, are there tests when people show up? Are they able to be tested? Or because T heard a doctor on the air the other day, not as good as you, obviously, not with your credentials, but he saw a doctor, and the doctor said,
I think it was a witch doctor.
What did the doctor say, T?
Here's what the doctor said. And honestly, this particular doctor, what he said made sense to me, but I'd like to get your take on it. He said, look, here's the deal. Let's say this particular virus, they were talking about who should get tested. When do you know you should get tested? He said, look, let's say this virus wasn't happening and you just happen to be at home and maybe you're feeling a little bit out of sorts. Given your symptoms right now, would you normally go to the doctor? And if the answer is no, that you would not go to the doctor, you probably shouldn't.
Would you agree with that, Dr. Polsky?
I went to the same witch doctor school. I would agree, and that's one of the messages that we've tried to convey, is that for people who are mildly ill, and again, these are for people who do not have significant underlying health problems.
Right.
So we did have somebody who's had an organ transplant. For that person, even though they were mildly symptomatic, it's imperative that that person is in touch with his physician and lays out a clear, individualized treatment plan. But for people who have reasonably good health, and especially for those under age 60, that we don't want them going out to their doctor's office, potentially exposing other people in the waiting area, although I see doctors for the most part are now switching and minimizing the number of people who come in. But there's really no benefit to their health. If I can get back to the testing for just a minute.
Sure, please.
There are two bottlenecks at the moment. One is the availability of test kits, and I'm sure everyone by this point is well aware that there just are not enough test kits.
Right.
But we have a second bottleneck, which is the labs being able to process the tests once the tests are performed out in the field, in some labs, it's as much as a 7 to 10 day delay.
Oh my gosh!
And so that's another issue when you have people who are relatively young, healthy, and minimal symptoms. Testing them just throws more and more tests in and continues to overburden the lab.
Because they'll probably be over it before they even get the results.
You're absolutely right. It does not change management at all. And for people who it's much more important that we get tests faster, then it delays those people's test results from being processed.
Hey, doctor, let me ask you something, because I know you have had to think about this in maybe the very rare down moments that you have. Okay, so let's get on the other side of this virus, and you're going to be king of the world for a day. What do we need to do as a society, as a community, as a nation, to better prepare for whatever's coming down the road next, so that we don't have these bottlenecks and these weird things where it's like, well, you don't have enough masks. What can we do so when we get on the other side of this, we can start it up and get ready for it?
Can we prepare for something like this?
Well, if I ever became king of the world, I would abdicate instantly. But,
Okay, good man.
This is really a reflection of the priorities of our nation's healthcare system, that we spend at least twice as much per capita on healthcare as any other country, but we spend over 99% of that on acute care matters. We spend less than 1% on public health and public health preparation.
So for the listening audience, I'm going to count myself. Okay, just for me. When you say acute care, what are we talking about?
Well, and I should change that to clinical care, because acute was probably a poor choice of words. So when people get sick, 99% of the dollars we spend are to treat people who have gotten sick.
Oh, I got you.
And
okay.
We're spending less than 1% on basic public health initiatives that help keep populations healthier. And when we end up in a situation like this, our infrastructure is not designed to be able to accommodate this really massive ramp-up in doing, in this case, testing, and then having labs that are ready to go to more quickly help develop appropriate treatments.
If you were to guess, and it is just a guess, I'm not
really
going
to hold you to anything.
But I think everybody's kind of looking for a little bit of good news, based on what we've seen in other nations, and the do you think that there's
any good news?
Or is there a timeline where we might see the numbers starting to drop?
I'm not going to get into the forecasting game. I think that's a fool's errand at the moment.
I know, but I want to drag you in.
But I will say, I think the best piece of news that I've seen is people really coming together as a community. People, well, you hear about people who want to sew masks to help out the effort. I know that I've seen at our health department, and I'm sure this goes for other agencies around the state, around the country, people who are now really, truly overworked. And still volunteering, coming up to me and asking what else can they help to do. And this is at 7, 8 o'clock at night, where they've already been at work for 12 hours. And they know the next day they're going to have a busy day. They still want to make sure what they're doing. So I think this is an opportunity that oftentimes it brings out the best in people.
That is great. And T had said it earlier this morning, but seriously, you guys on the front lines and gals and everybody who's working so hard, it goes without saying, but we need to say it, that without you, I don't know where we would be as a community. You guys work so hard, and we really, as a populace, we just appreciate you so much.
Well, thank you very much. And I know you're going to have to go really soon, so I do want to make one little plea to people, that I know that Easter and Passover are the same week.
Oh, God.
2 weeks away.
Yeah.
Families really should start thinking about how they may do things differently this year.
Skip it.
For grandparents and for any family members that may have underlying health conditions, that this may be the one time that they don't really want to gather.
Yeah, skip it.
I just had this conversation with my mother last night. It is so amazing that you bring that up, because I said, Mom, no, it's not happening this year. You're not going to have the ham. You're not going to have the Easter egg hunt. And it's because of you, because she does have underlying conditions. And there are a lot of nieces and nephews and young, and they don't know how to cough right. And I hope she listens, but she's very stubborn. So that is a great message to put out there. Just,
skip it.
Skip it. God will understand. He'll understand.
Right.
And the day before, whoever's doing the cooking can make a little to-go package and
perfect.
Drop it.
Right.
And then you can FaceTime or however you Skype or whatever, so everybody at least can share a little bit, but at least you're not putting people at risk.
Dr. Polsky, thank you for your time.
Thank you so
please
much.
stay healthy. The best to you, your staff, all the people around you. If there's anything we can do, I don't know what that would be, but if we can, we will. And please make use of us, all right?
I greatly appreciate it. Two of you take care.
All right,
Thank
thanks,
you.
bud.
Thanks, Dr. Polsky.
All right, good guy, good information.
Tried to pull him in.
I'm trying to. Come on, commit.
Tried to
Say it.
tell the future. We're going to be great by July 1. July 1 is the date.
Yeah. Well, I don't know.
Good for him. No, I appreciate that. I really do.
He's a good guy, and really seriously to all the workers who are on the front lines dealing with this, the ambulance drivers, the people getting at the hospital, the nurses. My God, the nurses who are dealing with all this.
And the people have come out of retirement to help out. Yeah,
it's a shame there isn't something that. I mean, I can't really help. You know what I mean? There's nothing I can do. I can't go to a hospital and
take
do
temperatures.
Right. I'm only going to make things worse.
I think you put this under your tongue. I'm not sure.
So it would be good if there was some way that we could help. You know what I mean?
I think we help them by doing exactly what they tell us to do.
I know, but I think it's...
I
yeah,
know you want to
I
do
know.
more, but you can't. But that's what we do as a community. We follow the advice. We
I know.
follow the
I
advice.
know.
We stay away from people. We try to make sure we wash our hands and social distance and do all that stuff. That's
Right.
how we help them.
Right. All right. So listen, that is the latest. I hope that you got something out of that. I know it's not what you want to hear. What you want to hear is, hey, we're 2 weeks away from everything being fine.
Right.
I don't know. Maybe we're 2 weeks away from some good news. We'll see in 2 weeks.
Right.
I know we'll get through this. I guess that's the bottom line.
Yeah.
I know we'll get through this. I know we will. It just sucks right now. But we collectively as a nation have had bigger threats. Mm-hmm. We've had more dangerous threats. Not only from viruses, from bad men and bad countries and bad things, and we've always gotten through it, and we will get through it. It just sucks right now. 827, our phone lines are open for you. If you want to give us a call this morning, you certainly can. The weather's good.